The state is investing millions of dollars to prevent pregnancy-related deaths.
Our Missouri Chief Capitol Bureau reporter Emily Manley has more on the effort to provide better care for Missouri mothers during pregnancy and postpartum.
In a recent report from the state, an average of more than 60 women die while pregnant or within 1 year of giving birth, which is why Missouri has one of the worst maternal mortality rates in the country. Those in the medical field say the most sobering piece of that report is that 85% of those deaths were preventable.
It didn't happen overnight, and it didn't happen from one single cause.
Missouri is looking at new ways to help save new moms and their families.
This is a huge opportunity for us to pivot to do better for these people. And I think, although we're not going to see results in the data show up tomorrow, we'll see lives saved soon.
According to a recent report from the state's Pregnancy-Associated Mortality Review Board, the #1 cause of pregnancy-related deaths was mental health conditions, including substance use disorders.
It is embarrassing that in 2023, almost 2024, with the advanced technology, that preventable maternal deaths are still occurring.
Now, the state's health department and the Missouri Hospital Association are teaming up in hopes of turning the tide.
Our maternal mortality numbers have increased rather than decreased, and they were already high.
This comes after the governor said earlier this year he was heartbroken to learn the state is failing in maternal mortality.
This is embarrassing, and it's absolutely unacceptable.
Leading Parson to ask lawmakers to approve $4.3 million to create a new maternal mortality plan, which includes creating protocols for maternal health care, a postpartum care plan assessing depression, and training maternal care providers on trauma and behavioral health care screenings.
And so those are the important connections that have missed, drive these numbers in Missouri that none of us are particularly proud of.
Earlier this year, a new law went into effect extending Medicaid coverage for new moms for up to 1 year after the baby is born, estimated to help 4,200 women a year.
We've got to raise the standard, the minimum standard of quality, and ensure that every single woman, preconception, during pregnancy, and postpartum, has access to quality healthcare services.
Now, many of these programs are still in the development stages, but the General Assembly is expected to continue to appropriate money towards this new investment. Some of the funding is being used to create a new maternal child health dashboard. Reporting from Missouri Capitol Bureau, I'm Emily Manley.